We are live with Diabetes 180, and we have a guest speaker today, something we don't do often, but every time we do, we always have fun. As you guys are joining in, make sure you are greeting us in the chat. If you're not too shy, let us know who you are, where you're watching from, especially if you're first time viewers. But those who are regular viewers, we always like to know that you're here. So let your presence known in the chat. We're talking about teeth today and dental health and how it connects to systemic health. Part of our ongoing series on longevity, because as my dentist friend here, I'm about to introduce you to, would agree, there's definitely a tie between the health of your teeth and your longevity. In keeping with our series on longevity, and who doesn't want to live longer, right? We're going to talk about how taking care of your teeth connects to that, right? Not just having a beautiful smile. So if you have questions in the chat, ask your questions. I'll be, as we have our discussion, I'll try to pay attention to the chat so that we can answer them, and Dr. Hardy can answer them. And of course, I know many of you may be watching on the rebroadcast when the live is over. I'll keep track of that. And Dr. Hardy, I'll probably just say, hey, I had a question last week, and you can answer it, help them out. So whether you're watching live or recorded, ask your questions. What do you want to know about teeth? This is your chance to ask questions to a dentist. How many times do we get a dentist for 20 minutes or half an hour to get their expertise on our teeth? So hopefully you guys are brushing your teeth out there. Who's brushing their teeth every day? At least once a day, right? So Dr. Hardy, thank you so much for your time. And I know you're busy. I mean, you're at work right now.
I day is ending though. That's great.
You said it, say that again.
The day is ending,
I
which
think
is great.
okay. Good. All right, all right. So you're in Texas right now?
I am. I'm in
Okay.
Frisco, Texas.
Okay, awesome. So a bit of a time difference. We're in the East Coast here. But thank you so much again for your time. So Dr. Hardy, we work together. So this is really great opportunity for us to kind of change hats a bit, right? And working in the prison system, of course, you see,
Mhm.
it's very exciting, right? Very eventful.
Yeah, eventful is a good description.
Right. So, yeah, this is kind of fun. We definitely got to make sure this is not the last time we talk about health.
Mhm.
What's really cool is that we have a lot of things in common, but one thing we do share is our love for a healthy lifestyle, like and specifically healthy nutrition and eating plant forward diet. So,
Yep.
before we go into the questions about teeth, like, is there, I guess, a reason why you personally pursue a whole plant food or plant forward diet?
Yeah, absolutely. I know that healthcare providers like yourself and a lot of physicians that I trust have told me that even though there may be cancer in your family, it's a lot of it relates to your diet. So the main reason that I do it is to prevent things like cancer and dementia and having relatives that have had things that you really just don't want to have as you age. And I
Yes.
would like to enjoy later years in life. So that's why I do it.
Nice. Smart enough reason for sure. All right. So, Yvette, thank you so much for joining. Good evening. Andrew, Play Stuff. Hi. The rest of you guys, if you want to greet us in the chat, and as we're going through our live, we're not going to be here long, just usually about 20, 30 minutes. So ask your questions as we go along here. But so Dr. Hardy, just jumping right into it, on the topic of teeth and longevity, why is dental hygiene so critical beyond just having a beautiful smile?
Yeah, so everybody wants to look nice, but if you have bacteria in your mouth, you just think that it's the gateway to the rest of your body. So all of those bacteria can enter your bloodstream and they're not just in your mouth. So they're going to spread to your heart and other areas of your body. Like a tooth abscess can spread to your brain. So you want to get it under control early. So we really emphasize prevention. We are very big on getting your teeth cleaned by a professional and then your at home hygiene.
Okay, yeah, that seems important. So the bacteria is the main cause of that, going straight from your mouth to the bloodstream, and that's what we're preventing, right?
Yes.
Okay.
And we're trying to reduce inflammation just like with every other part of our body.
Yep.
So
Yep.
You do not want inflammation in your mouth.
Yep. Are there common mistakes that people make when it comes to their oral health?
Yeah, a lot of times they feel like if they don't have pain, they are okay and they really don't have to worry about brushing twice a day or flossing. So I think one of the biggest mistakes is thinking that just because you don't have a symptom, you don't try and prevent things from happening. So I tell my patients breakfast, lunch, dinner, you're brushing your teeth, and at night before you go to bed, you're flossing. And after you floss, you're not going to do anything except drink water because you can't have sugar and bacteria on your teeth and expect to be healthy.
Yeah, that makes sense. I know I'm always trying to be very careful about eating right after I brush my teeth, and because it's basically sitting on your teeth all night, right? Feeding, I guess that's what we just mentioned, the bacteria feeding off of that food or whatever you ate. And that, does that matter what you're eating, or is it just food in general?
Yeah, so the bacteria want food just like we do. So if you are encouraging the bacteria to eat off of sugary foods, refined foods, sodas are horrible for your teeth. What they'll do is they'll eat those foods, but then they'll release, you can think of it like toxins in your body, and you might see small cavities in your teeth, or you might see red gums, bleeding gums, and that's really what causes us to have gum disease or cavities. And once you see it, it's always a lot worse. It's almost like termites.
Yeah.
They get inside and they destroy everything, look bad on the outside.
By the time you see that, that's a good analogy, because by the time you see the outward destruction, they've done tunnels so many,
Much,
so much, just yeah. So that makes sense. So yeah, you definitely point out some things worth highlighting. 3 times a day. So after every meal, you should be brushing your teeth.
yeah, so if at lunchtime I'm gonna have something sugary, even people think things that are healthy like raisins are okay for their teeth. If you're gonna have raisins, or if you're gonna have something sticky like your protein bars and all that, or eat something like that at lunch, you gotta brush it off your teeth. Otherwise, the sticky, sugary stuff gets in between your teeth, and the bacteria have a field day because you're not touching your teeth again for several hours at nighttime.
It
So
makes
you
sense.
need to brush it, and if I have something really bad like chocolate or something like that, you need to brush and floss it off. So people are often, they're worried because they get multiple cavities, like we call them flossing cavities right in between your teeth. That
Yeah.
comes from that sticky, sugary stuff that you leave on your teeth for too long.
Oh, okay. Greasy stuff foods too. Would you say like fat grease has the same effect too?
Well, it's not going to help you overall, but it's not quite as bad as the sugars.
That's sugar stuff. Gotcha. And I can imagine that people who are eating like high fiber, more plant, whole unprocessed plant foods, they probably have advantage too, right? As far as it not getting the sticky stuff on their teeth that bacteria is going to feed off of.
Yeah, if you're focused more on like broccoli and plant-based foods as opposed to something really sugary or like candy and chewing gum that has sugar in it, that would be much, much better.
Mhm. Do you have a good like, do you have a hard time getting people to make the connection between oral and systemic health in your clinic? Or I should ask you, do you try to educate your patients on that? Or is
Yeah,
it hard? Yeah.
yes, we try to have a concierge practice which focuses on whole body health because this is an implant center, but I can't just put an implant in your mouth. Some people come to me because they want things for looks, but if you don't have your teeth in the right position, if they need to be straightened or you have a destructive bite, we have to straighten them before we deal with replacing the missing teeth, like doing something like implants. And then also, a lot of people have sleep apnea. So they'll grind their teeth really badly and they'll want us to do things like just put a filling in it or, just put a veneer on it. But if you grind your teeth, you have sleep bruxism, you'll break anything. So we try to treat their sleep apnea and straighten their teeth with Invisalign so that overall they have a healthy dentition.
Okay. So there's definitely sleep apnea is a big reason why, for sure. Certain things you need to address before just a cosmetic change, right?
Exactly. And it's a phase treatment. So we take care of everything. We'll still get you your veneers, but if they're not going to last or they'll have a poor prognosis because you haven't treated the sleep apnea, we address that at first.
At first, gotcha. Someone mentioned a good question, I think here. Pinch and Twist, that's an interesting name. All right, Pinch and Twist says teeth are naturally slightly yellow. Prove me wrong. Is that true? Or is there a natural yellow tinge, I guess, color to teeth?
Some people actually have gray teeth. Some people have brown teeth. So not everybody has the yellowish tint.
Okay.
One thing about yellowish tints is they're easier to bleach. So if you want to do whitening or bleaching, it's easier to bleach yellowish tints than it is to do like grayish teeth or even the brown tetracycline staining.
Interesting. All right. All right. It makes, yeah, good question. So is teeth whitening dangerous? Is there any concerns with that?
Yeah, so if you have not had your teeth cleaned, I would not recommend you whiten them until we clean them because you'll notice a difference immediately just by getting the calculus and the tartar off. But there is a safe way. We actually use something in our office called Perio Protect, which treats gum disease, freshens your breath, and whitens your teeth. You can do that 15 minutes a day, and that'll whiten your teeth. But if you have something like a wedding or something planned, the whitening agents, the professional ones, they have built-in desensitizers and they have things built into them to not damage your teeth.
Okay, gotcha. Is there a specific like component of the whitener that's causing damage? Can potentially cause damage?
Well, some of my patients have told me on their own that they'll do things like, I just swish with peroxide.
Okay.
Well, you might want to add some things like fluoride. They're adding things to help with sensitivity and to help protect the dentin tubules will help. And that's what's in our professional solutions. So things like just grinding down your teeth to make them look whiter, you'll end up pretty sensitive pretty fast.
That's okay. Gotcha. Yeah, I know myself, I have pretty sensitive teeth. So yeah, I would want to make
So
an
low
increase.
doses over time is the way we treat people with sensitive teeth that want to whiten their teeth. Instead of using 40% right away, we might use 10% over a long period of time, and it works better.
Better than a stronger strength. Gotcha. So let's talk about appliances and implants. So that's what you do in your practice, right? Implants. Do you work on appliances too, like night guards, dentures, retainers? Do you also do that too?
Yeah, so night guards are critical for pretty much every patient. If their bite is off, if they have a destructive bite, we'll straighten it with Invisalign, get them in a retainer. Our retainers are kind of like a 3-in-1, so it serves as a night guard and a retainer and a bleaching tray if they want to bleach their teeth. But to me, one of the most important appliances is either a sleep appliance if you have sleep apnea or if you snore and you don't want to be bothering your partner, and also the night guard, which for us retainers serve as night guards, or you can just get a night guard.
I gotcha. Can you explain for what a night guard is exactly?
Yeah, so most adults at night, they have parafunctional movements. So basically while you're sleeping, you may grind your teeth, you may clench your teeth, and you might not hear it, you might not know it, but it, like 99% of the people, it destroys their teeth. So the night guard is very small. They're not big and bulky like they used to be. And it helps to separate your teeth and keep you from breaking your teeth at night. So it also prevents migraines. It treats TMD issues so that you're not putting so much strain on your jaw muscles at night.
Okay, gotcha. Is there, I guess, if a person doesn't know they're grinding their teeth, is there a way you can actually see that there are signs that they're grinding?
So our teeth are made for mastication. So if you see that your teeth they really don't have any points anymore or anything that can help you cut or tear up your food, if they're flat, or if you start seeing the dentin, which is more of a yellow color than a white enamel, you'll know that you're grinding your teeth, mainly if they're flat. And the way we deal with that first is to see if they need a sleep test, because if it's sleep bruxism, they don't just need a night guard. they would need a sleep appliance.
You said sleep. What was that second term? Sleep.
Sleep bruxism. So it would basically, you grind your teeth at night because your airway is closing, your tongue is collapsing over your airway, and it keeps you from breathing. So you start to grind your teeth trying to free up your airway to
Mm,
breathe.
wow, gotcha. And that, of course, I'm sure, is the cause of sleep apnea.
Yes, and a lot of times, people, you'll see that you're choking in your sleep, or maybe you're gasping for air, or maybe you even wake yourself up
Mhm.
snoring or something like that.
I know in my clinic we have a lot of people diagnosed with sleep apnea, and especially the men, they do not want that machine on their face. So they
Yeah,
always want to know, is there anything, alternatives? The first thing I always tell them is weight loss. A lot of times people
absolutely.
can fix it with weight loss. Um, are there any dental appliances that they can use instead of, or maybe if it's mild, instead of moderate or severe sleep apnea?
Yeah, so instead of them just cranking up their CPAP as high as it'll go, sometimes we work with physicians to use a dental appliance in combination with their CPAP. But
Mhm.
a lot of people just don't like a CPAP at all. And in that case, we would make them, would take a digital impression and make them a sleep appliance, which you can think of it almost like having two night guards, one on the top and one on the bottom.
Okay, interesting. Okay, so yeah, I'm sure a lot of people appreciate knowing that for sure. They have options. So you do also do implants in your practice. And by the way, guys, we'll make sure you guys have access to Dr. Hardy's information, so you can look her up online. She does videos, educating the public. And if you're in the what part of Texas?
We're in Frisco, Texas, not far from the Star Football Stadium.
Awesome. Yeah. So definitely check her out if you want to take advantage of her experience and expertise. When it comes to implants or bridges, like how does that, if at all, affect systemic health?
Well, if you can't chew your food properly, I have patients all the time that'll come in and say their doctors have told them they need to replace their teeth because they're having GI issues or stomach issues, digestive issues, or they're only eating high carb diets. They have dentures that are loose and not fitting well anymore. They can't chew anything. So
Yeah.
they're eating all the foods that you don't want to eat because that's pretty much all they can have is like high carb pasta type foods.
Gotcha. So just that makes a lot of sense. You want to be able to chew healthy foods, and
Yeah,
it's interesting that the healthier foods are usually chewier too.
that's right.
Yeah. Uh,
Vegetables need to be chewed.
yeah, they're a little chewier. So that's definitely a big reason for sure. Any other reasons? I guess is that the main thing? Chewing.
Yeah, you would be surprised how affected people become emotionally by not being able to eat properly or smile or laugh, or they don't want to go out in public and have to take out their teeth or their teeth accidentally come out.
Yeah.
And I have spouses that'll say, I have dentures, but I never take them out because I don't want my spouse to see that I have dentures.
Yeah.
So
Okay. Okay.
it just changes your quality of life because most of your life is based around what you can do in public or around other people
Yeah.
with dentures or missing teeth. And some people don't want to smile. They learn how to keep their lip lowered than their teeth so that nobody can see their smile.
Oh, yeah. That makes sense. To me, it's like almost equivalent to us guys when we get a new. I guess girls too. When you get a new hairdo, like you're a brand new person. That confidence is boosted over the roof. So
And
yeah.
yeah, I was going to say their missing teeth can cause TMJ issues like chronic migraines and problems like that, especially if you're missing more than one tooth. And some people they'll start to bite their cheeks or they'll have speech issues by having missing teeth.
Yeah. I can imagine too that a lot of people probably are very hesitant to do implants because of the fear of pain, right?
Yeah.
Is that something people should be worried about? Is it a concern? I think it looks like a pretty painful procedure. I can't even get I don't even like getting my teeth clean. So I can imagine the drilling and getting that, tooth in there. How is that experience when it comes to pain? I'm talking, I'm gonna take care of my teeth and never lose any by God's grace. But yeah.
Well, it's actually the implant is only usually a couple millimeters. It's not very large. It's just in our heads. We make things seem bigger.
Okay.
Uh, we use
Millimeters,
sedation.
This is not bad.
We use sedation for our patients to get them over the initial fear of a surgery visit, but it usually ibuprofen is all they need, honestly. It's less invasive than taking out a tooth most of the time.
Very interesting. So I got a question here from Joan. Joan, thank you for
Yeah.
joining us tonight. Would sleeping on your back or side help prevent grinding your teeth?
Oh, so now you're talking about how you're treating your sleep apnea. So
Yeah.
what will happen is when you do your sleep test, you're going to have different positions during your sleep test that would tell us what position you need to be in order to reduce the tooth grinding, because that position would improve your oxygen levels, and you would figure that out as you have your sleep test. So I would definitely highly recommend we check the best position for you with your sleep test.
Gotcha. That makes sense. Absolutely. And of course, just throwing out there two signs of sleep apnea, you guys. There's a lot of signs. The main one would be snoring loudly, waking up fatigued, tired, not feeling like you rested. Of course, the biggest one being observed breathlessness, that you actually stop breathing while sleeping. If that's observed, get your sleep test for sure. Get a sleep study test.
Yeah, and if they have high blood pressure, treating sleep apnea or snoring would really, really help that. So you would probably, a lot of people are able to reduce some of their medicines once they start treating their sleep apnea.
Yeah, that's huge too, for sure. Another question we have is from Dorothy Templeton. Thank you for joining us, Dorothy. Is Listerine bad for you?
Listerine has chemicals, so you can think of it as any of the other things that you may have in your diet that have chemicals in it, like some of the sodas and things like that. Listerine is made to kill some of the bacteria in your mouth, but it can kill good bacteria and bad bacteria. So we actually recommend all natural products for our patients, which work really, really well, but they don't have the chemicals in them.
Gotcha. Where can we get those products usually?
Um, One of the ones I use is Dental Herb Company, and you can get it from their website or you can get it on Amazon like everything else.
Oh, yeah, okay, awesome. Dental Herb Company. All right, cool.
Yeah.
That's easy to remember. So let's go on to our. I think we talked about bacteria and gum disease. But is there like connections to on this channel? We talk about diabetes, but of course other chronic diseases. You mentioned high blood pressure, about heart disease in general, dementia. Do you feel like, in your opinion, there's definitely a connection between gum health and chronic metabolic dysfunctions like heart disease, diabetes? Yep.
Yes, because so if you have gum disease, you can think of it as you are constantly having inflammation in your mouth. And the bacteria in your gums, they find those in linked to the arteries. You can see those same bacteria in your arteries. You can see it causing like dementia and other Alzheimer's. They see the bacteria related to Alzheimer's, the same ones that are in your mouth. So if you have uncontrolled gum disease, active gum disease, all of those bacteria are just increasing an inflammatory response that's affecting the rest of your body. And with diabetes, it can cause spikes in your blood sugar if you have gum disease. So it can make it very difficult for you to regulate your diabetes if you don't treat your gum disease.
Yeah, I think, like you said, one of the steps, along with the bacteria, is the chronic inflammation that it causes. That we know inflammation in a chronic state is never good. I always like to equate it to a construction crew that never leaves the house. It's just there breaking down walls that don't need to be broken down. So chronic inflammation, we know is not good. Definitely want to take care of our teeth for that reason. And then diabetes is interesting because it seems like it's like a double-edged sword because, like
Yeah.
you, like you said, it can cause your blood sugars to spike, but then the elevated blood sugars will then feed the bacteria. Bacteria kind of fosters and doesn't go away, which feeds to the infection which leads to chronic inflammation, and it's like a vicious cycle. So, yeah,
Yeah, our patients that have diabetes, it's harder for them to heal. So their immune system is compromised. And for instance, if they needed a tooth taken out, it's harder for them to heal and recover. And it's the same thing with implants. They can absolutely get teeth taken out and get implants, but they have a harder time healing and recovering, and they're more prone to gum disease just because their immune system is compromised.
Yep. Do you have what cutoff requirements for a diabetic if they want to do a procedure, as far as like their A1C or their blood sugar levels? Yeah.
Well, unfortunately, some people do not fully reveal to me how healthy they are, and diabetic patients are the same way. So,
Yeah.
what I would do is speak with a healthcare provider like you to kind of get a real view of how healthy they are, because they may have some issues other than just diabetes. And yes, we would ask if you feel like if we feel like it's controlled or uncontrolled. If
Yeah.
it's controlled, then we would try and see if it could be more controlled prior to doing something like implant placement.
Basement, gotcha. Same thing with blood pressure, which is easier because you're checking the blood pressure in the office, right? And you're calling me saying, "Hey,
Yeah,
Bert, yeah, we got a patient with a blood pressure of 180 over 100. Yeah,
exactly.
see him today. Yeah, yeah.
And the patient only wants to deal with the pain in the tooth, but we're trying to tell them, well, you might have a stroke or a heart attack tomorrow, so can we deal with that too?
Let's keep you alive. Let's start there.
Yeah. And
Um,
a lot of the treatments that we do, like we have to numb you, we have to give you anesthesia, we have to give you medicine, and we don't want to cause any issues.
Yeah, for sure. So, I mean, I just love this conversation because it highlights the fact that the whole body's connected. You can't just treat one without treating one part of your body and neglect another. We're all connected, and holistic health is important, right? So we
That's,
need to address all aspects of our health. That's why we have a dentist on Diabetes 180, right?
that's
So,
right.
it made me think of I almost forgot something I want to share with everyone is a study here that we talked about, right? This study, let's see if it's easier
Yeah.
to see here. It's actually probably easier just to see like this. That talked about the fact that having implants, I know that's really small. I wish I could have made it bigger. Let me see if I can make it bigger. Probably not. But it's a very interesting study. Just if I were to summarize it, that talks about brain health and having implants. They took 10 people, it's a small study, but 10 people with moderate to severe dementia, and they had either one group of them just having plain dentures, yeah, and another group with implants. And within, I can't remember the time frame, but within time, the group that had the implants had significant improvement in their cognitive scores. So, and it makes sense because prior to this, there have been studies that show that just that mastication, that the pressure of the top and bottom teeth pressing together stimulates the brain and keeps it healthy. So, again, that holistic approach, we're all
Right.
everything is so connected, which makes sense, the teeth and brain being connected as far as
Yeah. And somebody suffering with loose or just dealing with dentures in general, all they have is basically plastic to eat with.
yeah.
So that can be a little bit traumatic. So we lose like 80% of our ability to chew, our mastication, if we don't have teeth. So the implant is going to make them have a lot more force and be able to do more than if they just had plastic to eat on.
Yeah, that's huge. And well, one of my last questions for you would be, of course, on the subject of longevity. You would agree then that someone with poor dental health, their chances of living longer are probably diminished. I'm sure there's studies that show the link between longevity specifically and dental health, whether it be missing teeth or inflammation. Would you agree there's probably a connection here?
Yeah, I would say one of the biggest things is bone loss. So there is a point to where if you neglect your teeth too much, you have severe gum disease, you're going to end up losing a lot of bone. And then you also, if you have a lot of cavities, you might lose teeth. So trying to live longer, and we are living longer, you're going to need you need bone, you need jawbone structure, and you need your teeth in order to function. Just these are basic daily habits, like eating is kind of a basic habit. So that is part of it. And the other part is, again, reducing the bacteria that's spreading throughout your body. So patients can have a dental infection that spreads to their brain, or that it makes their other infections and things going on in their body worse. So a lot of our medical doctors, in order to improve their health and hopefully get the patient to live longer, they will ask us to do a dental clearance and kind of stabilize them dental wise. So I would say keeping your teeth and keeping your jaw box structure and your bone and your basically your teeth and your bones healthy will help you live a lot longer.
Awesome.
And definitely treating sleep apnea, that can add 10 years to your life right there.
Yeah, sure. That's a huge one. That's a huge one. So let's help the people know how they can follow you or see you, especially if they're in your area. Let me see if this is sharing on my screen. So yeah, this is the website. Let me see.
Yeah.
It is friscosleepcenter.com. friscosleepcenter.com. So make sure you visit that website if you're in the area. Tell us the area you're in.
So we also do virtual visits. So if you wanted to do a virtual consultation, there's a lot of things like Invisalign and sleep apnea treatment we can do virtually for you. But yeah, we're in Frisco, Texas. You can visit our website, or you can also please follow me on Instagram. We're very active on Instagram. And if you want to get a good laugh in, you can check out our TikTok videos.
Yeah, I've seen some of those videos. Definitely. Yeah. Good stuff. Good stuff.
Instagram, it's at dralicia.hardy. And on TikTok is dr.alicia.hardy.
All right. So, yeah, we got that. This is the Instagram. So you guys go ahead and copy that and visit her Instagram and TikTok. I'll put it up for them to see as well. It's in the chat, so you guys can check the chat out to follow Dr. Hardy and the great work she's doing to help our communities not just smile better, but live longer, right? That's huge.
So much for having us and giving us this opportunity.
Awesome. We'll have you back for sure. All right. So, beloved, I pray above all things that you may prosper and be in good health, even as your soul prospers. We'll see you next week.
Thank you.